we might have seen a lot of diagnoses which come on our prescriptions. So we'll try to figure it out. What is the difference between autism and other related disorders which we generally see on our prescriptions on the child's prescriptions? And we might get confused whether the child lands up in autism or whether there is an other issues and etc. and etc. So in this 45 minutes, we'll try to figure it out. What exactly is autism? What are the latest classifications and latest updates on autism and related disorders? So first of all, these are the various diagnoses which we might come across on the prescription. Classic autism, autism spectrum disorder, Asperger syndrome, speech language disorder, what we call as an SLD, or social communication disorder, or it might be Rett syndrome. So then another thing is pervasive developmental disorders, or it might be PDD, that is pervasive developmental disorders not otherwise specified. So all these disorders which are there, every one of us might have been come across all these diagnoses, and we might get confused what exactly my child lands up. So we'll be figuring out each of these and see what exactly means. Now, first of all these classifications which I have mentioned here, these are basically a part of autism spectrum disorder. Earlier, we were used to separate them as classic autism or autism spectrum disorder or Asperger syndrome or Rett syndrome or pervasive developmental disorder. But now all of these come under a common spectrum or an umbrella, what we call, it is called as an autism spectrum disorder. And the two important things which has been now been added under DSM-5, that is Diagnostic Statistical Manual 5, this is the latest, speech language disorder and social communication disorder. We might have also seen that the parents might have come up with a diagnosis of the child that he has an SLD or speech language disorder, or he has a social communication disorder. These are the two important disorders which have been added in DSM-5 but doesn't come under ASD. Other than this, all other disorders or all other diagnoses XYZ which we mentioned, these are basically come under the spectrum of ASD. So we don't nowadays classify as Asperger or pervasive developmental or PDD and etc. But we tell them, yes, it is a child comes under autism spectrum disorder. Why? Because the management doesn't change a bit. Only in certain cases the management changes, which we'll see in our future slides. So this was the old classification or DSM-4, which everybody of us knows. So initially what they found that autism spectrum disorders, they classified into different categories. Classic autism, where we say that the child has typical features of classical autism. Behavioral issues are there, or it might be communication issues, or it might be speech and language issues, not able to communicate, behavioral issues. So the typical feature which you will get in a child of autism spectrum, no eye contact, poor response to calling, no pointing. Then there was another sub-classification of this, which was, we call it as Asperger. Asperger, they told, it is specifically found in children who are specifically in males. Then it is found that the severity of this Asperger is less compared to the autism. Although the features are similar, but in Asperger, you will find that the child is in the mild category of autism. Then pervasive developmental, which was the term which was used, it was meaning that the child doesn't either fit up into autism, it doesn't fit up into Asperger, but there are issues which we can't say that he is having some other disorder. But some are mimicking, some are not mimicking. So that is why they put a term which is called as pervasive developmental disorder. So in a very simple way, it was confusing for the professionals also, and forget about the common man or the parents. So that is why the DSM-5, they figured it out and made this classification into a very simple classification, and all these things came under a one umbrella of autism spectrum disorder. So whatever name you give him, whether it is Asperger, whether it is autism, classic autism, whether it is high functioning autism, whether it is pervasive developmental disorder, it doesn't make a difference at all, because these were the old terms. Still now, many of the doctors might write that the child comes under PDD-NOS. That is pervasive developmental disorder, not at the specified. But it doesn't mean that he is not on the spectrum. He is in the spectrum, because these were the old terms. Now, these were the various classifications which we used to give earlier. Autistic disorder, that is classic autism. where I have told you typical classical features will be there: no response to call name, no eye contact. Then there will be typical behavioral issues, sensory issues, stimming will be there. All those things which are typical in autism, which will be present. Asperger, all the symptoms of autism will be there, but Asperger, they'll be mild. The main differentiation feature between an Asperger or autism is a child on Asperger will be not substantially dependent upon the parents or the caregivers. Means he will land up in a mild category of autism. If I talk in today's scenario, a present date, a child who is diagnosed with Asperger is also an autism, but he's on a high functioning. Nowadays, we use the term high functioning autism spectrum disorder, or is a high functioning autism. It simply means he comes under Asperger. And Asperger is more common in males compared to females. And we have seen, yes, autism is more common in males. It is 3 to 4 times more common in males than compared to females. Another important difference is in Asperger, the IQ level which will be almost equal or just partially low compared to a child who lands up in a typical autism or high degree of autism. So if I differentiate mild autism with moderate to severe autism, a child who is on mild autism or Asperger, which we used to call it earlier, will have a better IQ compared to a child who is mild, who is moderate to severe. Parents might have seen, or you might have observed, that their child has been diagnosed with autism and they give you a scoring, either ISA, Indian Scale of Child Autism, or they might have given you a scale on CARS, Childhood Autistic Rating Scale, or ADOS, or ADI. Different scales are there. Parents who are from US, they might have been might have been done the scoring on the basis of ADI or ADOS. Indian parents, they might have done the scoring on the basis of CARS. So you might have observed they have given you the scoring 30, 30.5, 38, 45.5. So 40, as the score increases, the severity of autism increases. Means the chances of Asperger is going less and the chances of going into the autism spectrum or moderate to severe is high. If a child is 29 score, that is mild. So they won't label it as a typical Asperger. They will label it as autism, because nowadays we don't use the term Asperger. But a high functioning is more in favor of an Asperger child, provided he's a male, because Asperger typically happens into a male, whereas autism can happen either in a female or a male. But yes, the ratio is 3 to 4 times higher in males than females. Rett syndrome. Now, Rett syndrome is somewhat another classification which typically happens in females. Pervasive developmental, it is just an old term for the autism spectrum disorder. Childhood disintegrated disorders has been obsolete. There is now in DSM-5, there is no such term which we uses. So we are not very much worried about what is this. So we are mainly concerned about classic autism, Asperger, Rett, pervasive developmental disorder, and some other new terms which I will be telling you. So this was the old classification which they have divided ASD into different. Now, as per the DSM-5 criteria, this is the latest criteria how we classify autism, or nowadays there is no such term autism. Why? Because if we use the word autism, then it becomes a confusion, because autism spectrum disorders earlier were classified into classic autism, Rett, and etc., which I have told you in the previous slide. So now we don't use the word autism. We use the word autism spectrum disorder. Under this, the child can land up in Asperger. It can land up into pervasive developmental disorder, not otherwise specified. It may land up into Rett. We don't know. But we know that a diagnosis of autism spectrum disorder comes by this following simple criteria. There are two most important criteria, criteria A and criteria B. Criteria A means social emotional reciprocity. In a simple way, the child is not able to express and understand his emotions and the emotions of others. And that we typically know and we have seen in our kids. So forget about these medical terms. We are not here to write an exam. We are here to understand the concept. So in a simple way, social and inability to understand the emotional regulations of other and of our, or what we call in a simple way, emotional dysregulation, which is a very common thing. Second thing is non-verbal communication, non-verbal social communication. They are not able to express themselves non-verbally, or sometimes they are not able to express verbally is definitely not there, but non-verbal social communication. That means they will not be able to express verbally, but they will be able to express non-verbally, either through gestures or taking away with the hands, dragging the hands. The third is relationships. That means what I was telling you, social emotional relationships, or means the ability to understand or build relationships with others, how to maintain relationships, or emotional dysregulation. So this is the criteria A. Now the third criteria B, which they have now included, is sensory issues. Now sensory issues till now was not the diagnostic criteria, or they were not considering to be to make the diagnosis of autism. Sensory issues earlier were used to be an additional criteria, but now sensory issues is a major criteria. And even in our previous webinars, I have always told, because when we talk about sensory issues, we talk about SPD, that is sensory processing disorder. And if any of the parents is from the professional background, or from therapist, or from medical background, they might have read in the literature also and during their time, that they say a child who is diagnosed with autism, 75% of the kids on autism have SPD. That means they say only 75% out of 100, only 75% of the kids who are on the spectrum will have sensory issues. But practically, we see more than 95% of the cases in children who are on spectrum will have sensory issues. Even I would say 99%. 99% of the kids who are diagnosed with autism will have sensory issues. That is immaterial whether they will have mild, moderate, or severe, or whether proprioceptive may be high, vestibular may be high, or it may be mild. That is a separate issue. But yes, 99% of the children who are on the spectrum will have sensory issues. And because of this reason, they found that sensory issues should also be included in the major diagnostic criteria for autism. So now we tell that my child is having autism. So, or autism spectrum, he should have these three important criteria. That is social emotional regulation, non-verbal communication, not able to express verbally, and third, they might be sensory issues. Sensory issues might come in the form of stimming, it might come in the form of fixations, it might come in the form of stubbornness, or they are very stubborn about routines, or restrictive stereotypic movements, or what we call as stimming. So this is the sensory issues can come up in various presentations, as I have told. So this is one important thing which should remember. We should not get confused with autism or autism spectrum disorder. Now, this is a separate thing, that what should be the onset, what is the level of language, that is not for us, that is for the professionals. But for us as a parents and as the caregivers who are working in the field of autism, they should able to understand the concept between all these different terms. Because many a times parents do come to us, sir, he is not in autism spectrum disorder, he is PDD. He is not in autism spectrum disorder, he is being labeled as Asperger. So we should have a clear idea, because nothing will change. The only neither your approach towards the treatment or the management will change, but you will have a psychological feeling, a good feeling. Yes, my child is Asperger, that means he's in a mild category. So even if you get a, even if somebody labels your child or makes a diagnosis of mild autism spectrum, so it's actually a good thing. It doesn't mean that he's not in the spectrum, or he's not in the Asperger. So now, as I was telling you about the social reciprocity, that this is a technical or the medical term. We are not confined with the medical term. We should know what does it mean. So that simply means that the emotional regulation, the child is not able to understand his emotions, and he's not able to understand the emotions of others. Now, for these two things, there are two important theories which has now been come. One is called as a theory of motivation. I'm not showing those slides. I'll be because there is some another topic in this which I can share. So I'll be more talking verbally rather than showing you the slides, because I feel it will be better if we can communicate like that. So there are two important theories which they say that why children on spectrum do not socialize, why there are socialization issues, why they are not able to understand the emotions of others. Because many times we see कि बच्चा बोलता नहीं है, हम उससे कुछ पूछेंगे तो वो जवाब दे देगा, लेकिन खुद से नहीं इनिशिएट करता. हम उसको बोलेंगे वो क्या है, तो he will respond, but he by himself will not say. That means there is no motivation to speak. So this is what we call as a theory of motivation. And so this theory has been highly accepted regarding the lack of social interaction in children of autism. Rather, I would say lack of initiation of lack of initiation of socialization. So this is theory of motivation. That is, there is no motivation for the children to speak who are on the spectrum. And there are different theories which has been given, thoughts which has been given, there is a disimbalance happens between the I would say the hyperactive and the the sedated transmitters, neurotransmitters. So there are two different types of neurotransmitters, excitatory and inhibitory. So whenever there is an initiation, or whenever somebody asks them, what is your name? Or whenever there is a scenario which happens where they have to maintain the interaction with each other, the disimbalance happens between the excitatory and the inhibitory transmitters. So this supports the theory of motivation. The other theory which was there, that is the theory of mind, which they told about, which was not considered to be, now it is not considered to be an approved theory regarding this socialization, because as per the theory of mind, they say that the child is not able to understand the emotions of others. And now the question comes here, the child on the spectrum is not able to understand the emotion of himself, then how can we expect he will be able to understand the emotion of others? So initially, first he has to understand the emotion of himself, and then only he can understand the emotion of others. So that is why the theory of mind was not being accepted now. The third theory which they comes is theory of underconnectivity of the neurons, means the connections between the cortex, which is the highest most center of the brain, and the cerebellum, that is the back portion of the brain, or the limbus, where the emotions and everything gets connected, it is disimbalanced or it is poor. And that is where we play about the concept of RMTI, rhythmic movement therapy. That is, we make the connections between the different areas of the brain strong. So in a simple way, theory of underconnectivity of neurons means that connections between the different areas of the brain are poor. And these connections are specifically poor in the cortex area, the frontal area, which is the main area which is concerned with socialization. Another important thing which we should remember is that many a time we see 20% of the kids who are on the spectrum, they might have seizures. And once they have an episode of seizure, the parent will suddenly tell that, sir, his socialization skills have drastically reduced. Otherwise, he was talking, he was speaking, he was initiating, but he had an episode of seizure and his socialization skills drastically reduced. Why does that happen? Because of the seizures. It is because the area where the seizure activity happens in children on spectrum has been found that in more than 75 to 85% of the areas, more than 75 to 85% of the kids who are on the spectrum, the sensory, the seizure activity happens to be in an area of the brain which is concerned with the area of socialization. So seizure activity can happen in any area of the brain, but in children who are on the spectrum, in 75% of the kids, the seizure activity, unfortunately, happens to be an area which happens to be connected with socialization skills. And that is the reason that there is a long, I would say, exponential relationship between the socialization skills and the seizure activity. So if the seizure activity is more, the socialization skills will decrease. So this is the relation between the socialization skills and the seizure activity. So coming to the triad of classical features, I have told you social issues, that is social social interaction, communication, that is non-verbal communication is there, and sensory. So this is the triad nowadays which is considered to be to make a diagnosis of autism spectrum disorder. Earlier it was only socialization issues and communication issues. The third was an additive one. It was plus minus, but it was not mandatory. Now it has been made mandatory. So now coming to, we are now concerned with the DSM-5 criteria. DSM-4 was old. So if you go through the DSM-4 on the left side, they have diagnosed pervasive developmental disorder. Okay. Now pervasive developmental disorder, they have given in DSM-4. Now they replace this term from autism spectrum disorder. So as I was telling you, pervasive developmental disorder was the old term. Now the new term is autism spectrum disorder. So whenever a parent, whenever an old school thought doctor or who were much senior to us, or they are not well versed with the latest criteria, they might write the child as PDD. So it doesn't mean he's something, a new term or some new diagnosis. It just simply means he's an under autism spectrum disorder, but that was the diagnosis as per the old criteria. And as per pervasive developmental disorder, they have given these subcategories, as was telling you in the slide 1, autism, Asperger, PDD, Rett, childhood, etc., and etc., to make us and the parents and the caregivers get confused. But now they have removed all these terms and they just make a single diagnosis of ASD. as it is mentioned is this table, nothing is there now, only one term is there, ASD. Under ASD, everything comes. That is why we have now given the severity of classification of ASD, mild, moderate, and severe. So now if we come about, now forget about this DSM-4. We are now concerned with DSM-5. So if we make a diagnosis of autism spectrum, I have told you category A must be mentioned. Means this is the category A. It should have social, emotional dysregulation and non-verbal communication. This is mandatory. Plus, he should also have at least two of the following categories in category B. Category B means sensory. So it doesn't mean he should have all the these 3-4 characteristics. Means he should have a sensory issues, which might happen either in the form of stimming, it might happen in the form of fixations or adherence to routine. So that is depends from child to child. And there are, so these are the main differences between these old terms which we used to happen and the new term. Now this is the new classification which has been given on, this is not on theory, this is basically practically. So these are the theoretical classification, these are practical classification which we as parents and professionals can see. So there are different levels of ASD, or I would say mild, moderate, or severe, or you can say level 1, level 2, level 3. Level 1 means child requires minimal support in doing his routine activities, or his IQ is good, or it is average, or it is not below IQ, or I mean below a certain level. That means less than 70, we call it as MR, or nowadays MR is also replaced, we call it as intellectual impairment. So a child who is on ASD level 1 or who is on mild, or in other words, he is an Asperger. Okay. So he will require just a substantial, not minimal support in doing routine activities. Whereas ASD level 2 means he requires little more substantial support in daily routine activities. Now there is no such, criteria that these are the criteria A, B, C, he should meet, he should require these substantial support, then only he will say as ASD2. No, these are very broad and, terms. So this has to be taken into consideration depending upon the ability of the child. So you as parents are the best, guide to judge your child whether he is in ASD1, ASD2, or ASD level 3. Then you have ASD level 3, which has profound or typical characteristics of ASD, or who requires a very substantial support even in small routine activities. For example, even if he wants to drink water, he cannot tell. Even he wants to go to, suppose he wants to pick up a glass, or he's thirsty, he cannot express himself. So those are the things where the child requires a very high substantial support. He cannot communicate non-verbally. Many a times, child who on the spectrum, they can communicate non-verbally. They will take the water if it is in their reach, or they will drag the mama's hand, papa's hand, that they want that thing if they are not able to express verbally, but they will do those non-verbal gestures. But children who are on the ASD level 3, they may just scream, they may just shout, they may not be able to express themselves what is happening. So there we call, and in these categories, they come under the category of around 20 to 25% of the kids. And majority of these kids who are on the ASD level 3 or severe category of autism and having a score of maybe 45 or more on CAR score, they are also required to go an IQ assessment, because many a times we might figure out why he's not able to understand these commands in spite of our continuous therapies from last 1 year. Probably the reason is he might be having a low IQ. So an IQ assessment is very much needed in a child who comes under the category of ASD level 3, or who is having a CAR score as severe or 44 or 42 and above. So this is what we want to take the information from today's webinar. We are not here to diagnose, or we are not here to get the technical terms. We are here to how to work with our child practically in the field and in practical scenarios in the house. At least we should figure out that why these things are not working in my child. Something is wrong, or are we going out of the track? Then Asperger, I was telling you, so this is a fancy term for high functioning ASD. So sometimes we might feel happy or satisfied that my child is in under Asperger, he is not ASD. So even if you tell he's ASD, or even if you tell he's Asperger, doesn't make a difference, because Asperger means ASD. But the only good thing is he requires a minimal support in day-to-day routine activities, or he comes under mild category of autism. But the one of the good important things about Asperger or mild category of ASD is that I would tell you two most important things. A child who is in category of mild autism, or other words, Asperger syndrome, they have a very sharp memory, or I would say they have a very good IQ, plus they require a very minimal support in day-to-day routine activities. But one important thing which differentiates a mild autism from severe to moderate is OCD. That means obsessive compulsive disorder. Not exactly OCD, but they have excessive obsession about particular things, or I would say fixations. And it has been seen that children who are on the mild category, they will have more obsession and fixation towards a particular thing, or a target, or a particular task, compared to children who are on the severe or moderate category. So that is why Asperger's, they are very cunning type. As if you go through the literature, and you might read in the newspapers also, especially in the, if there is a Western news which is coming, that nowadays the jobs has been open for kids who are on the spectrum, and Infosys or Wipros are now inviting children who are on the spectrum. But another day a news will come, a child who was on the mild category autism or Asperger has been thrown out from the job because of his cunning attitude, because of his cunning nature. He doesn't know how to talk, he doesn't know how to speak. So the reason here why I'm telling you, because Asperger's, they are very cunning, in the sense they are, it's not cunning, they are very fixative about particular things. They want that thing to be happen in that way, which might not be acceptable in a social scenario, in a gathering where you are working with a group of 10, or in a company or a society. So that is why we see that many a times mild category of autism kids have been thrown out from the jobs, compared to moderate to severe, because moderate to severe unfortunately don't get that opportunities to go into a job, provided if we work, or they might go into a vocational training, but not as a professional, I would say, job opportunities. So the symptoms and scenarios, or the picture is more or less the same. They will also have lack of social awareness. They will have sensory issues. But the only two differentiating features is IQ will be good, and also they will have very good sharp memories, or I would say they will have some unusual, things, or unusual talents which you might not see in a child who is in moderate to severe autism spectrum, or a neurotypical child. For example, sometimes mother will say, sir, he knows Telugu, he knows Malayalam, he knows Hindi, he knows English, he knows Spanish, but I don't know how he has learned. But he can speak. And I can guarantee you, out of these 38 to 40 parents who are listening here, at least one of the parent might feel, might have observed, not in terms of language, but maybe in some other scenario. And they will be surprised how he knows that. We have not taught him. But if we taught him ABCD, if we taught him A to Z, he doesn't know. But he can speak all those things which we find it difficult to remember, and which we find it difficult to learn. How does that happen? Because this is what we call as an Asperger Savant syndrome. All children on Asperger or mild category autism doesn't have Savant syndrome. It is one in some thousands. And there is a very good series which is coming in Netflix. If you are interested, you can watch it. You will actually get an idea of how this Savant syndrome happens. It is a Good Doctor. It's a series about good doctor, and it is coming on Netflix. You can see it. It is showing how, and it is. It's a movie about. It's a series about an doctor who is under spectrum, who is under autism spectrum, and he has some unique abilities. He performs, operations just by memorizing things, where this artery goes, and etc. and etc. So you will be actually fascinated to know that how this syndrome is so unique in itself. So we should be working on the strengths, making the strengths more powerful, rather than working on the weaknesses. So we generally figure out that isme ye kami hai, isko ye dur karni hai, and we forget about the powerful points of our kids. So I would say that yes, there is a need to work on the deficits also, but it should not be underestimated that we should not work on the strong points. Whatever strong points are there, we should motivate them and make them to work more hard, rather than figuring out deficits and working on them, because those deficits will definitely will remain there. It's not that they will be 100% corrected. Autism is such that it's not that I will say, okay, this will be cured by this much time. It cannot be cured. It's only that over a period of time, the child will get adapted over an environment, how to get, so it's basically a theory of adaptation, which will happen over the period of years by your efforts, by child's efforts, and by the caregivers. So this always has to be kept in mind. There are, I think, some questions or maybe some in the chat box. I will take it up later. So what is Asperger and what is classic autism? So this is what I was telling you in the previous 1 or 2 slides, that the difference between the two Asperger and classic autism, as I've told, regarding the IQ, regarding the severity, and regarding the unique abilities. So what is Savant syndrome? So Savant syndrome, as I've told you, that although it is mentioned 1 in 10 autistic kids, but no, this is actually not the exact number. The number is actually much more higher. It's not so common. Savant syndrome is not so common in children on the spectrum. Probably this figure is wrong, because I have taken it from the net. So the exact figure comes out to be more in 1 in more than hundreds. So then you talk about 7. So I was telling you 7 means a unique ability in the child. And this unique ability happens in the child who is in mild category of autism. It can happen in moderate to severe, but it is very rare. Generally, it happens in mild category of autism or Asperger. That is why whenever we talk about Asperger, we talk about Savant syndrome. So Savant syndrome means they have a very unique ability in any form. Either they may have strong mental abilities, they may have strong calculation abilities, they may have strong, I would say, remembering of dates memories, or memorization of numbers, or brain images. That means they can remember visuals very fast compared to any other kids. No doubt, visual memorization is much better in children who are on the spectrum compared to neurotypicals. But if we see among the autistic kids, some children might be having very strong visual memorization compared to other autistic kids. So that is because they might be having an ability of study. And if you tell, okay, is there any diagnosis how to make? No, it's not a diagnosis, just comes over a period of time and observing the child over a period of time. So what are the 7 skills I was telling you? Memorization, calculation, and date memorization. So these are some of the things which we might see in a child who is on the spectrum. Now, autism spectrum disorder, as I was telling you earlier, we used to classify all these things under social communication. Now, there is one new term which is being called as social communication disorder. Now, social communication disorder means, the name itself suggests that the child is not able to communicate socially. Now, in a very simple way, if I tell you a child is not able to communicate socially, the one thing which will come in our mind is the child under autism spectrum disorder? Is your child autistic? No. When we tell a child is being specifically labeled as a social communication disorder is a term which is different from autism spectrum disorder. This thing we should always keep in mind and make ourselves very clear, that if a child has been labeled as it has been diagnosed with social communication disorder, it doesn't come under autism spectrum disorder. So this diagram I have specifically taken because these were the old school of thoughts, where they were not able to make the differentiation between social communication or other disorders which we have discussed on the previous slides. So all of them were coming under autism spectrum disorder. But now social communication disorder is a separate entity from autism spectrum disorder. What is social communication disorder? We will see in our future slides, and how to differentiate between from autism spectrum. So as I was telling you, that PDD, that is pervasive developmental disorder, it was the old name for ASD. So if you tell my child is PDD, means he might land up into Asperger, he might land up into autism, he might land up into Rett, he might land up into etc. and etc. So a simple term without any confusion nowadays is ASD. No other term is nowadays valid, or it has been obsolete from the literature and even from the books also. So these are the 2 new terms which has now come under DSM-5. Forget about DSM-5. These are some 2 new terms which we generally come across the papers or with the parents, and parents might have also observed that my child is having social communication disorder, or my child is having speech language delay. Why I'm using these two words? Because a child on autism who is being diagnosed with autism will definitely have speech language delay, because there is social communication issues. Non-verbal communication is there. अगर नॉन वर्बल कम्युनिकेशन किसी बच्चे को है, दैट मींस स्पीच लैंग्वेज डिले तो हो गया, बिकॉज स्पीच लैंग्वेज डिले मींस हियर वी आर टॉकिंग इन टर्म्स ऑफ एक्सप्रेसिव स्पीच एंड लैंग्वेज. So sir, this is very confusing. When you are telling speech language delay, it automatically means the child is on the autism spectrum. No, it doesn't mean. Speech language delay can be a part of autism spectrum disorder, but when a child has been given a diagnosis of specific speech language delay, he doesn't come under autism spectrum disorder. But when a child is given a diagnosis of autism spectrum disorder, he can come under speech language delay. So there is a difference between the two. It cannot be vice and it cannot be vice versa. So this what we have to make ourselves clear. What does that mean? So here is a very simple chart I have given you. If parents want, they can take a snapshot of that, because recordings will not be available because these are live sessions. So what is the difference? Because these are the some two new terms which we often get confused. No, my child is speech language delay. He is not autism spectrum disorder. My child is a social communication disorder. He is not under autism spectrum disorder. Because, you know, we get a psychological feeling. It's very practical that if my child has been given a diagnosis by a pathologist or by a professional that he is having a speech language delay, so I feel little relaxed. Okay, at least ASD to nahi hai. Okay, my child is given a diagnosis of social communication disorder. Chalo, I'm relaxed. Thank God. God has listened to me. At least he is not an ASD. So it's true that when if you get a diagnosis of ASD, there is a complete setback to us, because we had never thought about that and we don't know how it happened, and even we don't know as professionals why does it can happen, why it happens in certain people, in certain group of children, and why it doesn't happen in another group of children. So that is a different scenario. So now coming to what is the difference between speech language impairment or speech language delay or social communication disorder. Now, social communication disorder is also known as pragmatic communication disorder. Pragmatic here strongly means that means the child is not able to express his language skills. Means he's not able to express verbally because he has speech and language deficits. But we have forget about two important points which come under ASD is one is most important is sensory issues. The child will have no sensory issues in social communication disorder. The child will have good imitation skills. The child will have good pretend play. Motivation, which I have told you, theory of motivation. The child will have a strong interest to communicate with others, but he will not be able to express. Okay. He will go away from there. And ASD kid, if it is there, hello, how are you? He will run away. A child who's on the SP, social communication disorder, hello, how are you? Not able to speak, but he's trying. That is motivation is there. So this is what we call as eye contact is there, interest is there, he's connected with the environment, he's connected, awareness is there. So that is what typically lacking in a child who's on ASD. So simply a child is on a speech language delay doesn't mean he's under ASD, but a child is on under ASD, definitely he will have a speech language delay. So this is very, very important to understand. Now, what is the difference between speech language delay and social communication disorder? We have made ourselves clear between speech language delay or social communication disorder and ASD. We can easily identify, yes, he's in ASD or he's not in ASD. But how to differentiate whether he's a specific language impairment or social communication disorder? That is not our job. That is the job of a speech language pathologist, if I talk technically. But if I talk in terms of for ourselves and for the caregivers, it is important to note that yes, I am able to differentiate my child from ASD and my child from a speech language delay or social communication disorder. So social communication disorder, there will be good imitation skills, there will be good pretend play, there will be no typical stereotypic movements, what we call as stimming. There will be definitely behavioral issues. There will be frustration. They might be throwing off things. They might be frustration. They might be hitting. But that is happening because he's not able to express himself. Because here the child is not intellectually impaired. His social, his psychology is very, very good. He understands that I'm not able to speak in a class of 30 child. children, and my peers are able to express each and everything, I am not. So he might throw things in order to gain attention towards the from the teacher. So he is showing an attention seeking behavior. Attention seeking behavior definitely happens in 90% of the kids in autism. But an attention seeking behavior does not always mean that my child is an autism spectrum disorder. It might be just because he's not able to express verbally and show he's showing all those frustrations. So frustration in a child on social communication disorder happens to be because of the delay in expressive speech. Whereas frustration in a child on autism spectrum disorder happens to be because of sensory issues, happens to be because of vestibular issues, happens to be of stimming, happens to be XYZ reasons, which we all know. But this is very, very important to differentiate between SPD and ASD. I hope I have made myself clear and very practically and in clear crystal differentiation I have given. And in spite of that, if we have some doubts, we can clarify in last maybe 5 minute session. So now, so SCD, I have given this term. So this is a new diagnosis which has come under DSM-5. So as I was telling you, if you see this diagram, there are troubles between inference and sarcasm, difficulty in making friends, because nowadays, you know, friends are, our peers are so fast. They might be talking so many things. Oh, my papa has given me an iPad. Oh, I have gone to that hotel. I have eaten that thing in restaurant. Can you imagine our kids on spectrum will be, or a social communication disorder might be talking that much? They might, even if say, hello, how are you? We'll be feeling so glad. We'll be go to the temple and give a blessings from the, get a blessings from the God that, oh, he has started and he is making these sentences. So forget about how fast those neurotypical kids are nowadays. So the thing is, that is the reason they are making difficulty in friends. If I just remove this term of social communication disorder and I just give you this pie chart of all these troubles which are happening, your mind will immediately shoot, your mind will immediately kick and will tell, yes, the child is in autism spectrum disorder, without thinking all those scenarios. So that is why, because these are some new terms which probably I feel because nowadays, you know, even a occupational therapist is sometimes give diagnosis that my child is in autism spectrum, but probably majority of the times they are right, because they are also seeing so many cases through the sensory and etc. But sometimes they might forget this term, what is known as social or pragmatic comment. Pragmatics itself means pragmatics, means related to language, speech, and others. So taking difficulty in turns and conversation because they are not able to understand. One thing we have to remember, when there is a speech language delay or social communication disorder, although there is an expressive language delay, but invariably a child will also have a delay of receptive skills. Okay, because a child will never able to speak unless and until he is able to understand. It never happens that I will speak first, then only I will able to understand what you are telling. I will only respond to you only when you are able to, only am I, if I'm able to understand what you are telling. If you talk to me in French, how will I will understand, and I will not be able to express. So the thing is, even in social communication disorder, there will be majority of the times, the majority will be expressive delay, but receptive delay will also be there. So as a result, all those issues will happen to be occurring, which might mimic a picture of autism spectrum disorder, but they won't be any typical features of sensory issues, pretend play lacking, imitation lacking, behavioral issues, and all those things. Behavioral issues definitely might happen in them, even in ASD, but the reason for happening is totally different. That is to be important and has to be figured out. So pervasive developmental disorder, I'm repeating these slides again and again so that we get so much familiar with these terms, so that whatever the term is being given, we are not bothered. We know that yes, there is only one term, autism spectrum disorder. So again, in DSM-4, all those terms were given: autistic, classical autism, Asperger, Rett, childhood, etc. and etc. Now, again, this was according to the DSM-4. So pervasive developmental disorder, they have given all these categories. Now all this has been replaced by autism spectrum disorder. If you see below in the diagram, I have mentioned autism spectrum disorder. This is the latest category. So it is ranging from mild to severe. Childhood disintegrated disorder doesn't come. As I was telling you, Rett is some disorder where there are two schools of thought. Some say it comes under autism spectrum disorder. Some say it doesn't come under autism spectrum disorder. The reason I will tell you in future slides. But as I've told you, Asperger, PDD, NOS, and autistic disorder all come under autism spectrum disorder. So a mild category of ASD means he is under Asperger. But Asperger exclusively happens in male. It doesn't happen in females. So this again the classification, that how this classification of autism has now replaced the term autism spectrum disorder. So now we don't use the term autism, we use autism spectrum disorder. So this was the DSM-5, as they have, as I was telling you, that DSM-4 was using the term pervasive developmental disorder, and it has been replaced by autism spectrum disorder, which includes all those terms of Asperger, pervasive, not otherwise specified, Rett syndrome. Now, so these were the new classifications. In DSM-5, there is no such term what is called as Rett syndrome. Now, I will give you a brief about Rett syndrome. So what is Rett syndrome? Rett syndrome is also a neurodevelopmental disorder, like an autism spectrum disorder. But the only difference why we don't, in practically, it is coming under ASD. But if you talk in terms of theoretical classification, or if some parents are from professional background, then I would say ASD doesn't come under, Rett doesn't come under ASD, because ASD can happen in males, even in females. Although the ratio is more of ASD is more in males, that is 3 to 4 times compared to females. But Rett syndrome, to the contrary, it happens exclusively in females. So that is why this is one reason that Rett syndrome has been excluded from the ASD spectrum. But because the picture and presentation is almost similar to ASD, so you can say it can be a part of the spectrum of ASD. One important thing is that there is, here in Rett syndrome, the child might be normal up to an age of maybe 2 years, or maybe up to the age of 18 months. Many a times we see that in females, if a child is female, because it happens in females only, the child was absolutely fine till the age of 18 to 20 months. He was speaking, she was having good imitation, she was interacting, but suddenly after giving an MMR vaccine, the child lost all his skills. Exclusively, there was a delay in speech and language, and there was a delay in his understanding. In fact, not delay, there was a regression. Regression means whatever she has attained, it was lost. If she was telling mama, papa, now she can become totally non-verbal. She was able to express his daily needs or ADLs, now it has been totally lost. So this is what we call typically regression. Now there is also a term what we call as regression autism or virtual autism. Regression autism means there you will find 2 saal tak the child was able to speak each and everything, and suddenly there was a loss and the child lost everything. Means there was some fever, some vaccination, and there was no or maybe a vaccine, MMR vaccine was given, and the child showed complete regression in all his skills. So what there we call it as autism regressions or regression autism. Whatever you call the terms, nowadays we don't use all those terms, it is only ASD. Because it is, although these are some new fancy terms, maybe virtual autism. Virtual means when the child is has been totally exposed to the gadgets and is mimicking a picture similar to a true autism child. So all those terms are there, but if we talk about practically, it is only one term, autism spectrum disorder. And for autism spectrum disorder, there are no genes. We go for genetic testing so many kids, but it's no use. It is only advisable only in certain categories. But whereas in Rett syndrome, there is a specific gene which has been identified, which is known as MECP gene. Because there is a gene which has been found to be defected, there is a mutation in that. But in ASD, there are no such genes. Now, this is the diagnostic criteria for it. That is not for our purpose. That is just to understand that Rett syndrome typically happens in girls, and it is very, I would say, uncommon. It happens in 10 to 15,000 girls, 1 in 10 to 15,000 girls. And typically there will be hand wringing movements or hand flapping. So we might get confused that the child with autism. There will be loss of speech, there will be coordination issues, there might be sensory issues, there might be breathing difficulties, anxiety issues. So if you see, all those pictures are typically mimicking that of an autistic child. So that is why it comes in autism spectrum disorder. But practically, again, we don't include theoretically under autism spectrum because it exclusively happens in females. And there's a typical hand flapping. which doesn't happen in typical hand flapping, and there won't be other issues like maybe imitations. They might be loss of imitations, but it will not be as typical as that of a children of autism. So yes, it is under an umbrella of autism, but it typically happens in females compared to ASD, which can happen in kids. So this was a brief about the various terms which we come across in autism spectrum disorders and various other related terms. So this was the idea to give this webinar to make ourselves familiar about all these terms. And thank you. Now I will open up for the questions for 5 minutes, and then we will close up because we will be taking up the session exclusively question answer session in the last at the end of this webinar series. Yeah, there is one question from Varka Garg. So my child is diagnosed with ESA score 91. Is he mild autistic? See, 91 comes under moderate categories because we don't include and as a severe, so it can be mild to moderate category, say. So how frequently evaluation should be done? I would request Payal to mute yourself and ask me, so that will be much better rather than
Yeah.
typing.
Actually, I was just checking because my son is right now 4.5. Okay, and after 3 years old of him, so we got that evaluation done. Okay, so he got, I think, 30 that time. Okay, the score. So they said actually it was like to mild to moderate ASD. Okay, and
Yes.
after that, obviously we started the process and everything, but we are seriously now being concerned, like almost 1.5 year we have covered for the therapy we started. We are going for the group therapy session, OT, speech and special education. Okay, but still we are not getting much progress. Okay, much progress means obviously I will not be saying no progress, but in which pace we were expecting, that pace it might not be happening. So we were just thinking, sometimes we get confused whether it was it was, if it would have been the mild to moderate, then after therapy started, the therapy process started, so the pace would have been little bit good, right? Okay, so
Better, better.
that,
Yes.
yeah, so there we get sometimes confused, like if sometimes I actually get concerned that if I will get any evaluation done now, whether it will go to moderate to severe or something like that. I'm sometimes I get confused actually, and also
Okay.
that whether this sort of parameter actually matters anything in the process of the therapy or not.
Exactly, exactly. That was, yeah. This last thing, last statement, you have actually practically you have highlighted it very beautifully. See, the thing is, whether the child is in the mild category, moderate, or severe category. The for us, the good thing is, yes, the child is in the mild category, so the issues are not much that high. But one thing
Hmm.
is very, very clear. There are so many, once a child is labeled with diagnosed with autism, you will see on
Hmm.
your prescription, start with OT, start with speech therapy, start with this, start with this, start with this. You will be
Right.
bombarded with so many therapies and you will forget what I has to do. I'm not aware of with all these terms. So the first and foremost, I suggest every parent that at least you have a Google on autism. You will get a broad idea because what exactly is happening in my child. Because many a times we don't know exactly what is happening in my child. He's sitting calmly and suddenly he starts screaming, shouting without any reason. So to start with the therapies, it's not that you have to start with all the therapies at a time. First and foremost, you as a parent should analyze that what is the ability of my child and from where I should start my therapies. And also, whatever therapies you are doing, the child
Hmm.
should be much more comfortable with you rather than with the therapist. Because for the
Hmm.
therapy, you are going only 45 minutes, maybe 50 minutes daily, or maybe thrice weekly. But if you are not working with your child at home, then it is no point. Because if you are, if the rapport between you and the child is not good, then there is no point in going with the therapist. And regarding whether he is improving or deteriorating, whether the thing is, if you have gone for the therapy since last 1 year and you are
Hmm.
feeling that things are not going right in my direction as it's supposed to be as much I am putting my effort. So that
Hmm.
means something is going wrong. Either the direction of the therapies is not going correct, or probably they are not going in the right direction or probably the type of therapies which are required for the child is not good. See, telling that, okay, he's taking OT, he's taking speech therapy doesn't mean, because OT also involves a lot of things. He might be having more of vestibular, so we might be giving more of other things. He might be
Hmm.
having speech related issues. We might be doing the things in a different direction rather than working on phonological or articulation. So I'm
Hmm.
just giving you an idea. That means something is not going correct, either
Hmm.
on your part or probably on the part of the therapist. So you need to work and have a discussion with your therapist that what is going wrong and how we can work together for the child. Okay, regarding your revaluation, revaluation will not add much to yourself, but it might have more trouble to you. If by chance, if the label is being given now from 30 to 34, so you will go
Hmm.
in a setback, and rather than going for deciding for the therapies, you will again go for a setback for a week. That what has happened now, what I have to do. So rather than worrying about that score, you worry about what are the things which are not working in my child and start working on them. And probably once you feel satisfied that yes, after a 6 months, I'm feeling much better compared where my child was 6 months back, then probably you can think of doing an evaluation after another 6 months.
Okay.
Okay.
Okay. Got it. And also the last question, actually, whether actually these things matters, this parameter matters, like whether it's mild or whether it's moderate, whether, because I have
See,
seen like yeah, yeah, go ahead. Yeah,
see,
sorry.
practically, these parameters matter in terms of our approach in helping with the child.
Okay.
Okay, so if a child has been labeled 30, for example, so
Hmm.
probably his
Hmm.
sensory issues might not be that much high. Now, these things matter only when you are working in the direction of those things. If you are
Hmm.
get a diagnosis from some person and he has labeled 30, but you are doing OT in a specific regular pattern, these things have to be given, or these are the set of exercises which might be happen to given. So, the scores and activities have to be tailored as per the needs of the child. Okay,
Okay.
but yes, definitely these things matter because they help us in approaching our therapies and approaching our goal, how to target.
Okay. Got
Okay,
it. Got it.
okay,
Sir, I
thank
have
you.
a question.
I'll just interrupt, ma'am. We'll take up the last question because as we have very limited time of 45 minutes,
Okay.
other
Sir,
questions, if they are remaining, we will take up in the session. I will take your question, ma'am.
okay. Sir, my question is, how do we calculate the IQ of a child when the child has sensory issues and all that?
Ma'am,
So
you cannot calculate, the clinical psychologist will calculate on the basis of
that's what,
certain
sir.
tools are there.
Clinical
Yeah,
psychologist only. As soon as the
yeah.
child goes, he might have lot of sensory issues. Within
Uh,
5-6 sessions, maybe they have to develop rapport and all that. Still, but do you feel that IQ can be taken out properly? Like will the score be right?
See, IQ, yes, score can be right, provided the clinical psychologist who is doing the IQs is well versed with those tools, because there are so
Okay.
many tools are there for IQ testing. So
Okay.
definitely, if you are getting if you are getting an IQ testing from a clinical psychologist, definitely I feel she or he will be well versed with IQ. So it
Okay.
will be
Sir,
an authentic
can you
report,
please
definitely.
name at least one tool they'll use for other than BKT, MISIC and all? Could you please tell me at least one name of the tool
Which
for
tool you are
ASD?
telling?
Any tool for to evaluate IQ for a child on
See, there
spectrum, sir?
there are basically 4 to 5 tools are there. Okay,
Okay.
and what we'll tell you, we will in the group which we have created, we will tell you the tools. So you can search and accordingly you can decide what tool you want to.
Thank you. Thank you, sir.
Okay, okay, okay. Thank you, parents. Thank you, participants, for today's webinar. And then we'll be meeting on today's Tuesday. We'll be meeting on Thursday again with another session on this. Dr. Neha will be taking. And regarding any webinars you have questions, you can make note down of those questions because we'll be taking up all those queries at the end of these webinar series. Thank you. Thank you very much.
Thank you, sir.
Thank you.
Thank you.